Picture this. Tomorrow morning, you wake up exactly like you always do. You feel rested, maybe a little groggy, nothing unusual, no tightness in your chest, no shortness of breath, no reason in the world to think anything is wrong. And yet, somewhere between the moment your eyes open and the moment your feet hit the floor, your body may be quietly setting up a cascade that cardiologists refer to as the deadliest window of the entire day. Not in some distant future, not a decade from now, potentially within the next 20 minutes. I want to be honest with you from the start. Heart attacks are not reserved for people who eat poorly or never move their bodies. They strike triathletes. They strike people who faithfully take their blood pressure pills every morning. They strike patients who sat across from their cardiologist 6 months ago and were told everything looked beautiful. And when they strike, more often than not, it happens in the first few hours after waking up. That is not random. That is cardiovascular biology. And once you understand what your body is doing in those first minutes after consciousness returns, you will never step out of bed the same way again. My name is Dr. Catherine, and for more than 2 decades, I have worked with patients in cardiology and preventive medicine, watching the same 5 morning habits quietly erode the cardiovascular reserve of people who had no idea they were in any real danger. What I am sharing with you today is not theory. It is pulled from peer-reviewed research and from patient stories I will carry with me the rest of my career. Before we go any further, do me one small favor. Leave a comment telling me how many hours you slept last night and what your very first action is when your alarm goes off. I read them, I respond when I can, and I promise you by the end of this video, you will see that answer in a completely new light. Let me walk you through what your body is actually doing while you sleep, because this is where the entire story begins. Sleep is not simply rest. Sleep is not your heart taking a break. Sleep is one of the most active, orchestrated, and complex processes you experience, and your cardiovascular system is deeply involved in it. Throughout the night, your blood pressure gradually dips. Your heart rate softens, and your blood, which has been moving through mostly horizontal vessels for hours, becomes slightly more concentrated as you quietly lose fluid through your breath and your skin. Think of your overnight circulation like a river that has slowed into a deep, still pool. Calm on the surface, but thicker and more sediment-heavy underneath than it was hours earlier. Then your alarm fires, and in the span of a single heartbeat, your adrenal glands release a wave of cortisol and adrenaline that scientists call the cortisol awakening surge. Your heart rate climbs, your arteries tighten. Your blood pressure can rise by as much as a quarter within minutes of opening your eyes, and the blood that had been thickened and sluggish overnight is now being forced to rush through vessels that just contracted. That combination of thick blood, narrow vessels, and spiking pressure is the exact set of conditions under which clots form most readily, and clots are what trigger the majority of heart attacks. Published research going back decades has shown that cardiac events cluster in the morning hours in a way that cannot be explained by coincidence, with some analyses finding the likelihood more than double what it is in the evening. This is why some cardiologists, only half joking, call the hour between waking and breakfast the widow's hour. Now here is where what I call the first 30 seconds matters so much. The cortisol surge itself is pure biology. You cannot fully prevent it. But the way you respond to it in those first moments either softens that surge or dramatically amplifies it. And most people, without ever realizing it, amplify it 5 times over with 5 consecutive habits. Let me walk you through each one. The first habit is the way most people physically leave their bed. The alarm sounds, and they snap upright, swing their legs over the edge, and stand. Some of you even leap. In that instant, gravity betrays you. Blood that was evenly distributed through horizontal vessels now pools downward toward your legs, and the heart, which was already being pushed by the cortisol surge, has to fight gravity to keep blood moving to the brain. This produces a brief but meaningful drop in cerebral circulation and a compensatory spike in pressure that some people feel as momentary dizziness and others do not feel at all. Consider a 67-year-old retired teacher named Margaret I once worked with from a small town in upstate New York. Margaret had well-controlled hypertension and was by every surface measure healthy. She felt a flicker of lightheadedness almost every morning for years and wrote it off as simply getting older. One spring morning, she stood up and felt what she later described as a warm, heavy weight settling on her sternum. She had a small, non-fatal cardiac event right at the edge of her bed, Margaret had what we call silent arterial stiffness, which is extraordinarily common in adults over 40, and her arteries simply could not absorb the force of that morning surge the way younger vessels once did. Think of young, flexible arteries like a new garden hose. You can flick pressure through them, and they flex to absorb it. Now imagine that same hose left in the sun for 15 summers. The rubber is dry, stiff, and cracked. A sudden pulse of pressure has nowhere to go. Something has to give. Inside Margaret's coronary arteries, a small cholesterol-rich deposit that had been sitting quietly for years, invisible on routine tests, had a fragile cap that tore under that pressure spike. Her body treated the tear as a wound and immediately began forming a clot. That clot is what we raced against in the emergency room. This mechanism, the rupture of what cardiologists call a thin cap plaque under sudden hemodynamic stress, is behind a shocking proportion of morning heart attacks, and many of the people it affects had no prior symptoms at all. The second habit compounds the first, and it is dehydration. 8 hours of sleep quietly drains nearly a pound of fluid from your body through breath and skin, and by the time you wake, your blood has thickened into a state measurably more prone to clotting. Most people respond by skipping water entirely and reaching for coffee, which actually pulls more fluid out of your tissues because caffeine is a mild diuretic. During the next hour, while your body is already under hormonal stress, your blood is at peak viscosity and peak clotting risk. Without realizing it, you are maintaining the exact internal environment a vulnerable heart cannot safely tolerate. The third habit is the one I think will surprise many of you, and it involves the small rectangle most of us keep beside the bed: the phone. The moment you pick up that device before your nervous system has fully transitioned out of sleep, you flood it with notifications, headlines, unread messages, and a dozen tiny emotional pings your brain interprets as threats. Your already activated stress response receives a second wave of adrenaline on top of the first. Research out of California has shown that people who check their phones within the first 5 minutes of waking carry elevated stress hormone levels through the entire day, not just the morning. To your heart, there is no difference between a physical danger and a text from your boss that arrived at 2 in the morning. The vessels constrict the same, the pressure spikes the same, and the cumulative effect is one more layer of strain on a system that is already at its most vulnerable. The fourth habit is so ordinary that almost no one considers it a risk factor, and that is how you breathe in those first minutes. When we wake tense or hurried, we slip into fast, shallow chest breathing that never reaches the lower parts of the lungs. Oxygen delivery stays subpar. Your body compensates by tightening blood vessels further to prioritize vital organs, which pushes pressure higher still. Meanwhile, shallow breathing keeps your nervous system locked in fight-or-flight mode, preventing the calm, protective parasympathetic response from switching on. Imagine trying to top off an almost empty gas tank through a tiny coffee stirrer rather than a proper pump nozzle. The shape and depth of your breath changes everything downstream. The fifth habit is temperature shock, and here we have two different versions. Some people throw off the blankets and step onto freezing tile in a cold bathroom, triggering an instant vessel tightening reflex stacked right on top of their morning hormonal peak. Others do the opposite and step straight into a scalding hot shower, which causes the exact opposite problem. Hot water pulls blood rapidly toward the skin to cool the body. Blood pressure plunges. The heart races to compensate. For a 49-year-old engineer named David from a suburb of Denver, this is exactly what unfolded one Tuesday morning. He had mild coronary disease he did not know about, and the sudden cardiovascular demand while navigating his morning cortisol peak pushed him into what we call demand ischemia. His heart muscle was asking for more oxygen than his narrowed arteries could deliver. He survived, thank God, but it changed how he treats his mornings forever. Now, not everyone is equally vulnerable to this cascade, and I want to be direct about who needs to pay the closest attention. If you are over the age of 45, if you have high blood pressure even if it is well controlled, if you carry type 2 diabetes, if you have ever smoked, if you hold extra weight around your midsection, if heart disease runs in your family, or if your cholesterol has ever been described as elevated, your cardiovascular system has less reserve to absorb these morning shocks. Your arteries are likely stiffer. Your plaque burden, even if it has never caused a symptom, is likely higher. And your morning cortisol response may be more exaggerated because chronic stress, insulin resistance, and poor sleep quality all amplify the size of that hormonal wave. I have seen patients in their early 50s walk into my office genuinely convinced they were the picture of health, only to discover on deeper imaging that they had been carrying silent plaque deposits for years. The body is extraordinary at hiding these things until something forces the issue. This is not meant to alarm you. It is meant to empower you, because the fix is genuinely within your reach, and the changes we are about to talk about cost nothing and require no prescription. If you are still with me and finding this valuable, do me a favor and type the word heart in the comments. It helps this video reach more people who need to hear it, and it lets me know you are following along. Let me walk you through what a heart protective morning actually looks like, because this is where the information becomes real medicine, and it begins the night before. Sleep quality is one of the most ignored cardiovascular interventions in modern medicine. People who sleep fewer than 6 hours or sleep in a fragmented pattern show significantly larger morning cortisol surges, higher inflammatory markers, and more reactive platelets. A consistent bedtime, a cool, dark, quiet room, and 7 to 9 hours of genuine rest is not a luxury. It is a clinical tool. I also suggest a small glass of water before sleep, not enough to wake you repeatedly, but enough to blunt that overnight blood thickening. When the alarm does go off the next morning, resist the urge to sit up. Lie still for a full minute. Take 5 slow breaths, inhaling through your nose for 4 counts while feeling your belly rise like a balloon, pausing briefly, then exhaling through your mouth for 6 counts. This simple practice stimulates the vagus nerve, the master conductor of your parasympathetic nervous system, and it begins softening the cortisol surge before it can do damage. Then ease yourself up to a seated position at the edge of the bed and remain there for another 30 seconds. Let your blood pressure find its footing. Think of it like letting a car idle briefly on a cold morning before you drive away. You are warming the engine. Your first priority once you are upright is water. Not coffee, not your phone, not the television. 2 full glasses of room temperature water, around 500 milliliters, and here is where a small detail makes a real difference. Add a tiny pinch of high-quality mineral salt, something like Himalayan pink salt or Celtic sea salt, not a full teaspoon, just a sprinkle. Your kidneys spent all night filtering sodium out of your blood, and without a small amount of mineral support, your cells cannot properly pull the water you are drinking into tissue-level hydration. This is not the same as heavily salting your food throughout the day. This is a targeted microdose that helps stabilize blood pressure in the exact window when it is most fragile. Now about coffee, and I know this one stings. I am not asking you to give it up. I am asking you to delay it. When you drink coffee in the first half hour of waking, you are stacking caffeine-driven vascular constriction right on top of your peak cortisol. You do not get more alertness. You get more cardiovascular strain. Wait 60 to 90 minutes. Drink your water, breathe, let your hormones naturally descend, and then enjoy your coffee. You will actually feel the alertness more cleanly because your own cortisol is no longer drowning out the signal. Movement matters too, but the nature of the movement matters even more. High-intensity morning exercise performed on a cold vascular system has been linked to a higher rate of cardiac events than the same exercise performed later in the day. This does not mean skip morning exercise. It means begin with 15 to 20 minutes of gentle movement, a slow walk, easy stretching, soft yoga, something that wakes your circulation without shocking it. After that gentle warming, your system is ready for more intensity. A 72-year-old patient named Susan, living in a coastal town in Maine, added just a 5-minute slow outdoor walk to her morning routine. Within 2 months, her ambulatory blood pressure monitoring showed a drop equivalent to what we often see after adding a second medication. That walk outside, by the way, delivers one more gift. Natural morning light entering your eyes communicates with the master clock in your brain and calibrates your cortisol pattern for the entire day. Light on your skin also prompts the release of nitric oxide, a molecule that relaxes your blood vessels the way a tense shoulder finally releases after a long massage. Nitric oxide is essentially your body's own internal pharmacy for blood pressure, and most adults produce less of it with age. Morning light is free, simple, and almost entirely overlooked as a cardiac intervention. 2 final adjustments worth considering. The type of alarm you use is not neutral. A loud jarring buzz triggers a startle response that spikes cortisol beyond what a gradual rise would produce. A gentle, gradually increasing sound, or a sunrise simulating light alarm, produces a far softer transition that your heart will thank you for. And the content you consume in those first minutes matters enormously. Reaching for distressing news or scrolling social media is, From a cardiovascular perspective, genuinely harmful. Starting your day with a few minutes of silence, a brief gratitude reflection, or simply watching the daylight change outside your window is not sentimental. It is clinically protective. Before I wrap up, please know the warning signs. Many morning heart attacks are preceded by days or even weeks of quiet signals people dismiss, a deep, unexplained fatigue that rest does not fix, mild intermittent pressure in the chest, jaw, left arm, shoulder blade, or upper back, shortness of breath during tasks that should not wind you, and that unshakable sense that something in your body is simply not right. These are not things to push through. If you feel them, especially in combination, please call your doctor, and in severe cases, call emergency services. A heart attack caught before it fully happens is a heart attack that never gets to happen. If this video served you, please hit subscribe and turn on the notification bell, because in our next video, I will walk you through the 7 everyday foods that silently stiffen your arteries without ever triggering a symptom. You will not want to miss that one. Drop a comment below telling me which of these 5 morning habits you recognize in yourself and which one you are going to change tomorrow. Hit that like button if this helped, and please share this with someone you love. A parent who leaps out of bed, a friend who lives on coffee and 3 hours of sleep, a partner who cannot seem to slow down. This information might genuinely save their life. Your heart has been beating for you quietly, faithfully, without ever asking anything in return. Give it 30 seconds of quiet in the morning. I promise it will give you decades back. I am Dr. Catherine. Take care of yourself. You deserve it.